Hello, I'm Dr. Prashad, and I'd like to speak with you about prostate cancer. Prostate cancer is very common. In fact, it's the #2 most frequently diagnosed cancer in men worldwide, and in some places, it's the #1 most frequently diagnosed cancer in men. While a lot of prostate cancer grows very slowly, there are also very aggressive forms of the disease, which can cause considerable illness and even death. A few of the reasons why you should know as much as you can about prostate cancer: as mentioned, it is very common and it does have the potential to make you very ill. Before we get into prostate cancer specifically, let's talk a little bit about the prostate. The prostate is a gland found only in males. It is located just in front of the rectum and just below the bladder. In younger males, it's about the size of a walnut, but can grow considerably to a much larger size in older males. In terms of its function, the prostate gland is part of the male reproductive system, and it contributes to a significant part of the ejaculate or semen. It produces a liquid that helps to nourish and keep the sperms alive. Specifically as it relates to prostate cancer, as we know, cancer can occur in all or any parts of the body. Prostate cancer starts in the prostate gland. And what this means is that certain cells in the prostate gland, usually the glandular cells, they start to multiply out of control. And when they multiply, they produce abnormal cells which continue to multiply. This eventually replaces the normal cells of the prostate and even starts to invade organs and structures outside of the prostate gland. When this occurs, this is known as prostate cancer. You might be wondering what the risk factors are for prostate cancer. While a lot of the origin of prostate cancer is not well known, there are certain things that we have determined that increase your risk for developing prostate cancer. The first is your age. The older you are, the more your risk for developing prostate cancer. Prostate cancer is most frequently detected in men over 50 years old, and it's very rare in men younger than 40. The other factor that puts you at an increased risk is whether you have a family member with prostate cancer. A family history of prostate cancer increases your risk significantly of developing prostate cancer. Yet another factor is your race. Research has shown that men of African descent in our population, specifically Afro-Caribbean descent, are more prone to developing prostate cancer. And unfortunately, they are more likely to develop very aggressive strains of prostate cancer and more likely to die from prostate cancer. Let's talk about some of the signs and symptoms of prostate cancer. Early prostate cancer has no signs and symptoms. In more advanced prostate cancer, there are some signs and symptoms that are usually related to the urinary system. So men will start to complain of frequency, wanting to go to the bathroom more often than usual. They will complain that their stream is not as good as it used to, that they may need to strain to pass urine. Some men may notice blood in their urine and blood in their semen. And other men may complain of bone pains in their lower back, their hip, and other regions of the body. These are all symptoms of advanced prostate cancer. And a reminder, early prostate cancer really has no symptoms. You might be curious as to how you may know if you have prostate cancer. Now, when trying to figure this out, the aim is always to discover prostate cancer as early as possible. That is, when the cancer is still confined to the gland. By discovering prostate cancer early, the outcome is usually better, you're usually less ill and less likely to die, and the possibility of cure is definitely possible. The best way to know if you have prostate cancer is to see your doctor and have your risk assessed. When we speak of risk assessment with prostate cancer, we're generally referring to the fact that you're going to be screened for prostate cancer. Being screened for prostate cancer means that you may not have any signs and symptoms, and you might be just generally well. Screening takes you in that position and basically assesses your risk that you may have for developing prostate cancer. Let's talk a little bit more about the screening process. Now, there is no one test to determine that you have prostate cancer. It's a combination of factors that your doctor, your urologist will take into account to determine your risk. One of the first things that your doctor will do is he will take a thorough history, which is to ask you several questions that are relevant to prostate disease. He may ask of your urination, may ask whether you're having any significant weight loss or bony pains, and other relevant questions. After a thorough history is taken, the next step is to examine the prostate. Examination of the prostate is done with a gloved, lubricated finger that is placed very gently into the rectum. This allows your doctor to feel the prostate, and he's looking for certain clinical features that might be abnormal, such as nodules, asymmetry, or unusual hardness. This usually only takes a few seconds and it's not painful. After the history and examination, usually there are some very targeted investigations that include some blood work, such as the PSA, a urinalysis, which checks your urine, and often an ultrasound. Now, you may be familiar with a blood test called a PSA, and I would like to speak a little bit about this. You should be cautioned that PSA is usually associated with the prostate, and many persons use it to determine their risk for prostate cancer. While it can be useful under certain circumstances, it really is very subject to interpretation and should not be used in isolation to determine your risk for prostate cancer. What this means is that if you are discovered to have a high PSA, there are many different things that can cause this to be high, not necessarily prostate cancer. The opposite is also true. Even men with normal PSA values could still have prostate cancer. The bottom line is, when assessing your risk for prostate cancer, there really is no shortcut. It's techniques that involve a proper history, examination, and investigations. And you should see your urologist to make this determination. Now that you've been screened for prostate cancer, let's talk about what will happen next. There really is only one way to determine whether you have prostate cancer, and that is to take a biopsy of the prostate gland. Taking a biopsy of the prostate gland means that you are taking core samples of the gland, and those samples are being sent to a pathologist who will look at the tissue under a microscope and will be able to tell whether you have prostate cancer or not. The reason this becomes relevant is you can appreciate that it's not practical to simply take biopsies for everyone, and that's where screening comes in. If you are screened and determined to be at high risk for developing prostate cancer, your doctor or urologist will usually recommend a prostate biopsy. If your risk is determined to be low, then usually nothing else is done, and you're perhaps asked to see your doctor again in a year to be rescreened. So let's talk a little bit about when you should start worrying about prostate cancer. The general perception is it's an old person's disease. And in terms of putting an age to it, you should start being concerned about prostate cancer at about age 50. Now, that's under general circumstances. If you're of African descent, if you have a family history of prostate cancer, you want to start having a conversation with your doctor a bit earlier, at about age 40. So it's not necessarily just a disease of the old. Let's now talk about if you've been diagnosed with prostate cancer. This is usually, as you remember, done by a biopsy. And if you're confirmed to have prostate cancer, the priority now shifts on trying to figure out the stage of the prostate cancer, which means trying to figure out whether the prostate cancer is limited or confined to the prostate gland, or whether it has already spread outside of the prostate gland. There are many different treatment options available for prostate cancer, and these are usually determined by the stage of the prostate cancer and how aggressive a form of prostate cancer you're determined to have. In terms of the treatment for prostate cancer, there are many different treatment options available and a very wide spectrum that range from active surveillance, which basically means no medication or no surgery. But it can also, if confined to the gland, your doctor will discuss with you, and you might be a candidate for surgery, which is removal of the prostate gland, or even radiotherapy. For more advanced stages of prostate cancer, there's hormone therapy and even chemotherapy. Treatment for prostate cancer is highly individualized, and it's a conversation that you will have with your doctor, and depending on your needs and circumstances, a treatment regime will be tailored for you. Let's talk a little bit about how we can prevent prostate cancer. There are several risk factors that we really cannot modify, and these are your age, your family history, and your race. However, there are certain things that you can do to decrease your risk for developing prostate cancer. The first is that you can always have a healthy diet, which means one that contains a lot of fruits and vegetables. Exercise regularly and try to maintain your ideal weight. One of the most important things that you can do when concerned about prostate cancer is to start having a conversation with your doctor about it as early as possible, and see your doctor at the appropriate time and get screened at the appropriate time.